I'm sure you would have seen or at least heard somewhere that you shouldn't sleep in contact lenses. If you didn't know, well, now you know. I don't know about you, but whenever someone tells me not to do something, I want to do it even more. And I've told a lot of people not to sleep in contact lenses, and if they're anything like me, then we've got a problem. I'm going to tell you exactly why you shouldn't be sleeping in contact lenses and what the risks are. So without further ado, let's begin. The thing that optometrists fear most when they hear stories about people sleeping in contacts is the chance that their eyes will develop hypoxia and/or a microbial keratitis. Hypoxia just means that your cornea isn't getting enough oxygen, in other words, it's suffocating. And a microbial keratitis means that you've developed an infection, in most cases a bacterial infection. The thing that you have to remember here is that the cornea doesn't have its own blood supply, and therefore it must get oxygen from the atmosphere. If they had their own blood supply, then the cornea would look a little something like this. Luckily nowadays, the material that most contact lenses are made up of give the cornea enough oxygen to breathe. But it's never as good as when you don't have any contacts in. Each contact lens material will have a different oxygen transmissibility rating, and the higher the number, the more oxygen it allows the cornea to have. One thing that you may not know is that depending on whether you wear daily disposable lenses or monthly reusable ones, the oxygen transmissibility can vary significantly. Let's quickly refresh our memory on what sort of replacement schedules are available. Firstly, you have daily disposable lenses. These are the ones that you use every single day and you dispose every single day. They are perfect for people who either wear contact lenses very occasionally or suffer from contact lens related dryness. To give you an analogy, I would say it comes close to something like disposable cutlery. It's clean, convenient, and once you use it, you never use it again. But unlike plastic cutlery, contact lenses are recyclable, and therefore, once you're done with them, I would encourage you to put them in a container and go to your local contact lens recycling hub to do your part. Daily disposable lenses are going to be the most hygienic option for many because you're using a new lens every single time, especially for those who suffer from protein buildup on their lenses. For the best option available, my suggestion is to see your local optometrist. They will assess your eye health and give you the recommendations that are best for your own eyes. Secondly, you have monthly reusable lenses. Monthly reusable lenses are great for people who primarily wear contact lenses rather than glasses, and it can even be cheaper for some in the long run. However, it does come with the inconvenience that you have to remember exactly what day you open the packaging because you'll need to discard it exactly 30 days from then. Not to also mention that you'll need a case and solution to store them overnight for that 30-day period. Monthly contact lenses are more robust than daily contact lenses, and in most cases, they have a higher oxygen transmissibility. Oxygen transmissibility is not labeled on the packaging, so you'll need to do your own research online to see what your lenses are rated at. Some manufacturers don't even mention it on their product guide, which is quite annoying. And lastly, we have fortnightly lenses. Fortnightly lenses are the best of both worlds. They are more hygienic than monthly lenses, and compared to daily lenses, if you wear them every single day, it will be cheaper in the long run. I find that the people using reusable lenses are the naughtiest when it comes to not sleeping in them. Maybe it's because it feels so comfortable that they feel it's okay to do so. But it's not, okay? And here's why. In some cases, when you have a foreign object, like a contact lens, in your eyes, it's quite normal for your eyes to not like it. As a response, the eyes send out antibodies to investigate. And in some cases, it might even lead to what we call mast cell degranulation, which is just a fancy term to say that your eyes are having an allergic response. There's something on me! There's something on me! Alright, eye, what's the matter? I don't know, man. You gotta send some help here. Alright, I'll send over some antibodies to help you. That's definitely a foreign object. I'm gonna have to call in some mast cells to give us a hand. Alright, what's the issue here? I don't know, man. Can you just get rid of it? That looks like a pretty tough one. I'm gonna have to degranulate. What? No! In this case, I would recommend seeing your optometrist as they'll be able to assess exactly what the reaction is and give you the necessary treatment. You can see why this becomes an issue for when you're sleeping, because for the 8 hours, or for how many hours you sleep, it can cause some serious damage. You'll wake up with a very sore eye, and possibly even some light sensitivity. But not only that, it will significantly increase your risk of infection. In my omega-3 video, I talked about the different layers of your tear film. To keep things simple, I said that it can mainly be divided into two parts, the water layer and the oil layer that sits on top. In fact, there's a third layer which no one really talks about, called the mucin layer. The mucin layer is what protects the cornea and allows the tears to stick onto it. Wearing contact lenses for a long time can deplete the mucin layer, which can cause dryness, but more importantly, it gives bacteria like Pseudomas the chance to stick onto the cornea directly, as there is no more protection remaining. In the worst case scenario, Pseudomas can actually perforate your eyes within 48 hours, so it's definitely not a joke. And bacterial colonization can also bring in inflammatory cells that are also recruited to investigate. Inflammatory cells are like your modern day superheroes. They appear when you need them the most, they take care of the villain, but in the process, they partly destroy your city. Same thing with our own immune system. Inflammatory cells will come to investigate, they'll take care of the villain, but in some cases, it can actually cause damage to the tissues around it. So ideally, you don't want the villain causing havoc in the first place. The trouble with sleeping in contact lenses is that by closing your eyes, you're not allowing enough oxygen to get to the cornea. And secondly, by not actively blinking, you're allowing the bacteria to stay still and release exotoxins that can damage your cornea. Believe it or not, this happens more often than you would expect. In fact, I had a patient the other day that came in with the same issue. This picture right here is a contact lens wearer in their 20s who's come into the clinic because their vision had gone down with mild soreness and a little bit of redness as well. On this picture, we can see that the blood vessels are being recruited towards the cornea, which means that the immune system is trying to sort things out. What was really surprising to me was that when I put sodium fluorescein in, which is a dye that helps me see the surface more clearly, I could see that the corneae had been very severely damaged. All the green patching that you see here, that's corneal damage. This patient wears contact lenses every single day, and just from the appearance, I could see that it's been going on for a while and they only recently just got it checked. Luckily, this wasn't sight-threatening and was easily reversible. But had they not come in, then it could have been a different story. When you hear contact lens horror stories like the one here, you can be put off by it. However, just remember, if you follow the exact steps that your optometrist tells you, you should never run into this issue. So please do not put your eyes at risk. It is honestly not worth it. If you're suffering from contact lens related dry eyes, then check out my other video on that topic. But with that being said, I'm going to end the video here. If you learned something new or at least found something useful, then yay, thumbs up to you. If you want to thumbs up back, then that would be greatly appreciated. Subscribe if you haven't already, and I'll see you in the next video.